Welcome to The Backstory, a podcast from the North Dakota News Cooperative that takes an in-depth look at the stories we're reporting for you. I'm Sabrina Halverson, CEO of the North Dakota News Cooperative. Joining me is Michael Standaert, our lead reporter. The story we wanted to talk about today is headlined, Proposed VA Staffing Cuts Have Local Veterans Worried. And Michael, you talked with quite a few local veterans about this, and actually you and I both have. I talked with them off the record, of course, with you being the reporter, but we have both been hearing from local veterans who are concerned about cuts. What are some of the things that you heard when you were researching this article?
Yeah, I get it with a lot of these stories recently. I've seen national coverage on it, but I hadn't really seen much coverage from inside North Dakota. So thought I would check around with veterans and see what their concerns are. The potential of staffing cuts of 72,000. The initial idea was possibly 83,000, but the VA Secretary Doug Collins had later said it was about 72,000 that's coming up in the next few months. So the concerns are, even if these positions are administrative staff and this sort of thing, that could potentially lead to longer wait times and erode care. It's concerns about calling in about prescriptions or calling in about appointments and getting to those appointments, because over the last decade or so, there's been tremendous progress with the VA of providing care for veterans. And a lot of veterans have become used to that, and they don't really want to go back to what it was a decade and a half ago, or be pushed to community care where wait times just keep increasing as well.
That was a concern that we read a lot about in the article, was the wait times. Now, one thing about North Dakota, I will say that our healthcare wait times tend to be very low when compared to the rest of the nation. When you were gathering information from the VA, have you seen anything that showed the VA was concerned about wait times and things like that?
So the VA does publish under law, they have to publish the wait times at all their facilities across the country. So I was looking around at Bismarck and Fargo, and for a cardiology appointment, it's about 4 to 8 days. And then nationally, I was trying to figure out what the wait times were for North Dakota. It was hard to find that information. So I looked at national data. It was about 26 days for the same type of appointment. Yeah, a couple of the veterans I spoke with had been exposed to Agent Orange, one in Korea. He served right next to the DMZ, the demilitarized zone there. And another was in Thailand, both during the Vietnam era. And this PACT Act that came into place in 2022 really helped to increase the care and coverage for those people that weren't covered before for exposure to burn pits and Agent Orange and other toxic substances. I think there had been people covered before directly in Vietnam, but not some of the people that were in places where they hadn't really declared whether they used it or not. These people had been allowed to have care at the VA later under this PACT Act. So most of the veterans I spoke with are very happy about the care they receive with the VA. Many of them also receive community care. It depends on what's going on with their situation. And they say the wait times are longer for things they have to go to at community care. And they feel treated very well at the VA clinics. They feel it's personalized. They feel it's veteran informed care. So the people know that they're veterans and they know some of their background. And if they've been in there several times, they have a good understanding of what they've been through. With mental health care, wait times around the country can be quite long too. And mental health care within the military community, especially if they've served in a combat zone or some other situation like that, can be a bit different than what you're getting from community-based care where they're primarily treating maybe addiction or some other issues like that. So the therapists and people they work with are especially attuned to their PTSD things, and even someone mentioned the military sexual trauma issues from their service time. So if those staff cuts go through, they say that it's not going to affect care, but I think a lot of the veterans don't really buy that. They think you can't cut that many people without it affecting care. We'll see. It remains to be seen whether they can pull it off.
I tend to be a logical thinker. And to me, when you're talking about cutting 72,000 jobs, there's no way that's not going to affect care in some manner. Even if we're talking about administrative jobs, people who are in offices somewhere off-site handling paperwork, those things take time, and the longer it takes, the longer these veterans are going to have to wait for care. That, to me, is the logical succession of events after these cuts. But I want to
Mm.
focus more on what you were hearing and research that you did. I know that the VA has not given a lot of information out on specifics, and that had to have made your job harder.
Yeah, I tried to reach out to some VA offices, and I spoke with the somebody with Veterans of Foreign Wars and some of these other groups that are associated with veterans, and they didn't really seem to want to say much at the
Mhm.
moment because it is all speculative. The speculation is that huge amount of job cuts will impact veterans.
That's North Dakota News Cooperative reporter Michael Standaert on his article, Proposed VA Staffing Cuts Have Local Veterans Worried. And joining us now for this episode of The Backstory is one of the people who Michael interviewed and is in his article, Keli Berglund, who is a former department commander for the Disabled American Veterans here in North Dakota. Keli, to start off with, please go ahead and introduce yourself to our listeners.
My name is Keli Berglund. I am the former department commander for Disabled American Veterans here in North Dakota, serving two terms, 2019 and 2020. I've spent years advocating for veterans at our local, state, and national level. I was a DVOP for Job Service North Dakota and currently the mayor for the city of Lincoln.
All right. Well, during your tenure at the DAV as state commander, what were some of the most important pressing challenges that you found as far as veterans' access to health care goes? I'd like to start out with a little bit of what you experienced or what you saw that were some challenges during that time before we had any type of funding cuts.
I think one of the biggest things that we in North Dakota face is our rural veterans and them receiving adequate care, timely care, and they're already dealing with fewer clinics, traveling longer distances, and staff reductions are just going to make that worse with longer wait times, fewer services, and that's really unacceptable for the men and women who have served our country.
Right. And you yourself are a veteran, a Marine veteran, I believe, correct?
I am Marine Corps veteran.
So you know firsthand some things that veterans go through and what you go through in military service, but then also the way that in being a veteran, services that are just expected.
I don't know that as military, whether that be the Marine Corps or any other branch, that it's expected, but it is earned. And we need to differentiate that the veterans have signed up to protect our country and they've earned that medical care after they leave service.
So when we're talking about cuts to that type of care and to our veteran system, like what we discussed in the article that Michael Standaert wrote for the North Dakota News Cooperative, when we're looking at cuts like that to these services that veterans have earned, what could this mean for, our North Dakota veterans?
I I have the understanding that most of the cuts are going to be administrative, those scheduling records, benefits, but those are the people who make sure that the care actually happens. Or not we, but at the VA, they're often short staffed with their medical staff. And that's a concern. And then when we add this extra layer to it, that makes it a little more difficult. And when you cut those support staff, it creates, more delays and the frustration for the veterans trying to get appointments or answers to their medical questions.
One of the things also that's been on my mind, and please always correct me if I'm wrong, it happens, but from what I understand, a lot of, or yeah, I guess I'll say a lot, many VA employees are veterans themselves. And so is it possible that we're also taking jobs from veterans with this?
I don't have those numbers in the statistics, but what I can tell you is with my dealings with my healthcare professionals, that is the case. That a lot of those, the staff, medical and support staff, are veterans. And when Veterans seek help. A lot of times, the people that they're looking to are people that are going to understand what they're going through. So I think it's very important to point out that veterans serving at those VA hospitals, at the clinics, are very important support wise to the veterans that are coming in. And so if we remove those individuals, the veterans that are working at the VA, that's another level of support that's being taken away from those that are coming into the clinics or the hospitals.
I'm not a veteran myself, but I am the daughter and mother of veterans.
Mm.
And so I personally have not gone through any services at VA, but both my dad and my son have. And but for our listeners who maybe have not had any, experience with VA hospital or other VA services, can you tell us a little bit about what are some of the services that are offered to veterans?
I'm just going to point out straight away that I can speak from experience that I've received great care through the VA here in North Dakota. We have a solid system, and it's proof that with the right structure, some of this rural care can happen. And I'd love for our national level government to take a look at North Dakota, first of all. But some of the benefits, the health care that's provided, you've got mental health, which is absolutely more important than ever as we see the rise in veteran suicide, the PTSD, sexual assault recovery, and those are things that really impact currently. But I mean, you can go from specialty care, in podiatry and mental health and a whole gamut. Anything that you receive out in the public sector are things that the VA helps take care. And depending on your disability for service connected ratings, you could have access to vision, you could have access to dental, which is, really necessary for a lot of veterans too.
One thing that really stuck with me from reading Michael's article was wait times. And I don't know if I'm just extra sensitive to this, but North Dakota has fantastic wait times for services at a lot of our veteran facilities, according to the article and the research that Michael did.
Mm-hmm.
And I'm able to compare that, like I said, with services that my dad had to go through in California, or my son, he's currently in Connecticut. And so contrasting those three different areas, the wait times in North Dakota are amazing because they're so short when compared to
Mm-hmm.
more populated states. You mentioned, I think during our first question, that a lot of these cuts would be more administrative. And I'm curious, again, always correct me if I'm wrong, but I'm curious if that could lead to, I mean, just in both of our non-expert opinion on this, I guess, but if
Mm-hmm.
that could lead to additional wait times and slow things down, especially when we're talking about services that are urgent. Mental health care, that's urgent. You can't wait a long time if you're in a mental health crisis or heading into a mental health crisis. You need to get in and see somebody.
Right. And the wonderful thing with the VA, we have those community based outpatient clinics that you can go into. But if you are having an emergency, then you can call the VA and they're going to get you in there. But one of the things that the VA has done and that I have worked through is if I have an appointment that is necessary, if I have a referral, then I'm able to contact, or I don't do the contacting. The VA actually schedules those appointments within town, within the Bismarck Mandan area here. And without those individuals answering those calls and doing the referrals, those wait times are going to increase because you're going to have them call rather than, currently what I experience within a week's time, I've been getting a call saying, "Hey, we've got an appointment for you out on town, and you can go to this clinic or that clinic, 3 o'clock, 2 o'clock, and come to your appointment." If we don't have staff on that phone making those calls, coordinating with our clinics locally, that's going to just increase that time. Absolutely.
So overall, with what you've seen on the cuts and proposed cuts that perhaps haven't happened yet, are you concerned or do you think that it won't be felt too heavily? What are your overall thoughts on it?
I think we need to be worried and we need to have this out in front of us. If those roles disappear or reduce, the veterans are going to feel it. It might not be on the exam table, it might be not be sitting face to face, but it's going to be the front desk, the people on the phone, or possibly those mixed referrals like we were just talking about. And those cuts are going to affect the access to care, especially in rural states like North Dakota.
Mhm.
And we need to make sure that we ask, you know, tell us where those cuts are going to be, when it's going to happen, because we need to protect the rural communities, especially. And if we can do things like continue supporting telehealth, because that's become very popular now in the medical arena, but having those mobile clinics going out to different communities, those are also going to be very important to continue. So, yes, it's going to be, it is concerning and could have an absolute spiked effect on the veterans in North Dakota.
You bring up two services that I can imagine are very important in North Dakota, our state being as rural as it is, telehealth and those mobile clinics. Those really serve people in rural areas that have a hard time getting to our cities. So the importance of keeping those active in North Dakota, I can see as being very important.
Very much so. On a personal note, my primary care professional retired, which is wonderful for that individual, but then it left that absence. And sometimes it takes 6 months, a year, maybe even longer to fill that position. So I know on my end of it, I had a year's worth of telehealth. And it was very beneficial when you're able to access healthcare in different cities. But again, with that, you still need to have that support staff to facilitate that getting together of the appointments, keeping those records, and providing support for the physician assistants, the doctors, the nurses, and all of them.
So overall, what would you say would be the most important things for our listeners to know about the cuts that have been made and the proposed cuts to the VA?
I think that we really need to make sure that we use our voices, because if you don't share your concerns, nothing is going to be done. Okay, so we need to keep using the benefits that you've earned. Speak up, make sure you contact your veteran service officers. Every county has one. Let them know what's working and what's not. And again, we also have our congressional delegates. We need to make sure that they know your concerns and reach out to them.
Thank you again to Keli Berglund for joining us. She is the mayor of Lincoln, North Dakota, and former department commander for disabled American veterans in North Dakota. You can read that story on our website at newscoopnd.org or in one of our local newspaper partners. For the North Dakota News Cooperative, I'm Sabrina Halverson. This has been The Backstory.